Hi, my name is Dr. Miller, and I'm Director of Central Ohio Functional Medicine, Health and Wellness Consulting. Today, I'd like to continue a weight loss series that I'm doing on factors that involve good weight maintenance. And normal weight requires normal metabolism, and we do a number of tests that pinpoint metabolism problems. Today I'm going to review blood sugar hormonal control, a few dietary habits that are associated with effective weight loss, and then expand on the necessary blood work relative to managing blood sugar. Everyone knows that high carb foods are converted into blood sugar very quickly. Foods such as bread, pasta, potatoes, corn, and rice in excess will raise blood sugar. And blood sugar is eventually stored there as glycogen in the body. About 400 to 500 grams of glycogen are stored, mainly in muscles, 300 to 400, in the liver, maybe about 100. Once the liver and muscles are filled, that excess glycogen is converted to fat and stored in fatty tissues. So there's a principle, a keystone principle really in regards to eating balanced meals, and we've all heard that principle mentioned. We should eat carbohydrates, proteins, and fats all in the same meal. And the percentages differ a little bit, but 30% carbohydrate or 30% protein, 40% carbohydrates, 30% good fats. So that's a good principle to follow just in general, and I'll expand on that in a little bit here. Genetic testing, we do some genetic testing because genetics influence metabolism. Some people may do a little bit better with more protein, a little less carbs. Some people a little bit better with more complex carbs, less protein. Some people just need higher percentages of good fat. But genetic testing can provide greater insight into those percentages. Some physicians really recommend the avoidance of most carbohydrates. But the reality is that 25% of all the carbohydrates we eat are converted to glucose there, go directly to the brain, and the brain is very glucose sensitive and very dependent. So eating complex carbs that are very nutrient dense are an excellent fuel source, and it's both the quantity of those carbs and the quality of carbs. Now, the quality of carbs, or really it comes down to something called glycemic index. You may have heard of that, and it's a measurement of how foods raise blood sugar and insulin levels. There's high glycemic foods, moderate and low, and the key to managing blood sugar then, of course, would be minimizing the very high glycemic foods, consuming more low and moderate glycemic foods. So now glycemic load, a little bit different. It just really says something about the carbohydrate content of food, how much food it takes to raise glucose and insulin. An example is carrots. They're high in the glycemic index, but low glycemic load. So you have to eat a lot of those to really have an impact on blood sugar insulin levels. The most important hormones relative to, and there are many, all hormones are important relative to blood sugar management, but insulin and glucagon are the two that I'd like to talk a little bit about. Insulin carries glucose into the cell for energy. Insulin levels can become elevated. Now, there are many reasons for that. The number one reason is consuming too many processed high carb foods. Second reason, many times when you're under high stress, it's going to release a lot of cortisol, and cortisol induces increased insulin levels. That's bad for your carbohydrate metabolism. The next thing, we always talk about the importance of exercise or movement as part of good health protocols. But if you do not move and do not get a lot of exercise, the insulin receptors are desensitized. The more active you are, the more sensitive those insulin receptors become, and you produce an enzyme called lipase that helps you burn fat. Another reason for increased insulin is lack of sleep. So how you sleep is important, and there are a number of other hormonal imbalances that can increase insulin. But the main point I want to make is that increased insulin is definitely related to weight gain, to obesity, hypertension, high triglycerides. Insulin can even become less effective, and we call that insulin resistance. So you say, wow, sounds interesting. What kind of symptoms might I have if I have high insulin or insulin resistance? Well, one of the common ones is that you will crave sugar or sweets just after eating a good meal, where you may feel exceptionally fatigued after eating a meal. You may feel the need for stimulants. All those things relate to the fact that you are not getting blood sugar into your cells. So the primary presentation are those type of symptoms, but difficulty losing weight is really the number one symptom that people have when they are insulin resistant. Now, you can have hypoglycemia and dysglycemia. When you miss a meal, you might get shaky, you might be irritable, maybe you have afternoon craving for sweets. But I think the three facts you should remember about insulin is insulin transports sugars into cells. The second fact is one that most people don't realize: it transports fats into cells, and that's also important. But when you have excess insulin, that's a negative feature. What it does is it transports fats directly into cells, it stores the fat, and prevents the body from burning fat for energy. Now, there's another hormone that I just mentioned, is glucagon, and it helps balance insulin. It helps muscle tissues burn fat as the preferred fuel, instead of blood sugar, and it helps you release stored fat. So glucagon is a fat-releasing hormone, a fat-burning hormone. You're asking, hey, how do I get more glucagon? Eating a balanced meal, believe it or not, eating all three food groups in balanced portions, carbs, protein, and fats, help increase glucagon. There's an inverse relationship between glucagon and insulin. You have high insulin, you have low glucagon. High glucagon, low insulin. So if you eat a lot of sugar and a lot of starch excessively, you're going to raise your insulin, you're going to lower your glucagon, you're going to store more fat, and you're going to have less fat burning. That's what it comes down to. So here at this clinic, we do testing. When we do the test, it defines what's wrong. We treat what's wrong. We do diagnosis first and then treatment. That's the correct order. So some of the tests that are vitally important, and some of these might be done in your family doctor, but not a lot are done in this manner or to really pinpoint problems. So fasting glucose, of course, to assess your blood sugar. Estimated average glucose, not done. And that is very, very important, because your blood glucose levels can really go very high with eating similar foods. Hemoglobin A1C, everyone knows about that, glycated form of glucose, sugar and protein coupled together, very damaging, an indication of the previous 3 months, how you've been doing managing blood sugar. So those three markers are very, very important. Fasting insulin tells us about your insulin levels, and very rarely tested. Proinsulin, very rarely tested. It's a precursor to insulin and tells us something about your pancreas, which produces that. C-peptide, also very useful in hypoglycemic and also residual beta cell dysfunction if you are an insulin-dependent diabetic. HOMA-IR is the gold standard for insulin sensitivity. It's a calculation. Last time I talked about adiponectin. It's a fat-derived hormone, protects against insulin resistant. I talked about leptin, another fat-derived hormone that suppresses appetite. It can be elevated, and you can become leptin resistant. Your brain doesn't respond to that to tell you that you're full. Also do some other really important ones. High sensitivity C-reactive protein. It's normally associated with inflammation, but also associated with insulin resistance. This test is an important test because of clotting problems. It's called plasminogen activating inhibitor. It is a marker of visceral abdominal obesity and also fatty liver, and it's involved with clotting. I also look at cytokines. Those are messenger molecules that are some are noted to be associated with inflammation and insulin resistance and an increased risk for type 2 diabetes. These tests that I'm talking about, that particular profile, are really the gold standard for handling sugar problems. They're generally not offered by your family doctor, or maybe not even a specialist. This is sort of a functional medicine type test because it's more personalized. We're going to be able to develop recommendations relative to managing your blood sugar as that impacts your weight. So we can make better lifestyle recommendations, we can make better dietary recommendations, and we do tests that are designed to measure nutrients that affect insulin, glucagon, increase metabolism, affect satiety, improve insulin sensitivity. And those are critically important tests. If we have to, we'll even send you back to your family doctor for medication if that would be needed. But most of the time, with lifestyle, dietary management, and measurement of the appropriate nutraceuticals that impact insulin and glucagon and your metabolism, your ability to burn fats, your ability to burn carbohydrates, your ability to metabolize protein, we do very well with that. I have good knowledge in this area, good experience, good confidence, and most importantly, good success in treating patients with these types of problems. Be my privilege to help you if you're struggling with weight issues. Feel free to contact me, info@cofmhwc@gmail.com, or go to my website, cofmhwc.com, and you can find out more information there. Thank you very much for your time and listening.